Hello dear students, hope you can hear me. Just let me open the comment box so that I'll be able to look at your comments. All right, good afternoon. So, yes, of course, I'm starting as soon as possible. There is no delay and all because I do understand one day before the exam, I do understand the value of your time. So, I have been through the situation, so I can totally understand. We are starting, we are not going to delay any further. All right. Chalo, hope I'm audible and visible. Dr. Puneet. Just give me that confirmation once. I'm audible and visible. You just give me that confirmation and we'll start. Guys, come on, quickly tell me if I'm audible or not. Let me confirm it myself. Okay, all right, all good. So everything is visible, everything is fine. So chalo, let's start with the first question. So this is gonna be a very quick session of pediatrics. So in which I'll be discussing few of the important questions just right before the exam. So it consists of few image-based questions, few frequently asked questions, few confusing topics, all of it which we are going to do very quickly. Okay. So let's start with the first question. Subscapular skin fold thickness is measured by which of the following devices for the measurement of total body fat? The first question is what? For the measurement of total body fat. So to measurement of total body fat, we have given an option that is archidometer, vernier calipers and Harpenden calipers and Shakir's tape Okay. So what is the answer? First, let's break it down. Archidometer. What is this archidometer? Archidometer is used for the measurement of testicles, my dear students. Used for the measurement of testicles. Vernier calipers, all of you studied in physics. In physics, it is used for the measurement of diameter. Okay. It is used for the measurement of diameter of some object. Used for the measurement of what? Diameter of some object. And Shakir's tape is used for mid-arm circumference. What is that? Mid-arm circumference measurement. So we are left out with what is that? Harpenden calipers. That will be the correct answer. Harpenden calipers. Okay. Hope I'm audible. Okay. Let's continue. What is the answer? What is that? Harpenden calipers. Okay. Very good. You are absolutely correct. Hello, Veer. Yes, correct answer. Okay. So now what they're telling, subscapular. Subscapular means what? Below the scapula. Subscapular means below the scapula. So we are going to use Harpenden calipers. So how does this instrument look like? So this is your Harpenden. What is that? This is your Harpenden calipers. So these Harpenden calipers, my dear students, used for the total body fat measurement in this particular manner. It is not just done in the abdominal wall. It can be done on the triceps, biceps, and subscapular region. It can be done in multiple areas. Okay, and your archidometer, that is your size of the testicle measurement. So you have these small beads which is of a increasing size. This meter is used for the measurement of testicle. This is your archidometer. What is that? Archidometer. Okay. Then we are going to the next instrument. What is that? That will be your Shakir's tape. So this is your Shakir tape. So most favorite question of examiner from the pediatrics. One of the favorite questions is your Shakir's tape. Okay. Very good. All right, let's go to the next question. Which of the following age the child has the maximum growth postnatally? Which of the following time? Postnatally means after birth. Okay, so after birth, which of the time the child has a maximum growth? Okay, come on, quickly tell me the answer. In first year of life, in second year of life, in seventh year of life, in adolescence. Okay, so please remember the correct answer is your first year of life. What is that? First year of life. Why first year of life? See, first year of the life is the time where baby's weight gets doubled and also even your height gets doubled. Okay, height and weight both gets doubled. Okay, so if the you get, sir, what about growth spurt? What about your growth spurts? Yes, so growth spurt is there, right? So during the time of, what is that? During the time of maturation. Okay, growth spurt. So growth spurt and first year, the when, which is the correct answer? So when you compare, first year of the life is more correct answer than your growth spurt. So first year of the life has the highest growth compared to that of growth spurt. Okay, compared to that of what? Growth spurt. When compared to both of them, so that is your first year of life. Never make a mistake. First year of life is the maximum growth. Okay. All right, let's go to the next question, my dear students. A case of 17-month-old child who, upon examination, had mongoloid slant of eyes, epicanthic fold, and simian crease. Okay, very nice. Her growth is retarded with no dentition. Remember, with no dentition, no teeth. There is also a history of delayed dentition in one of the sibling. Means there is a history present. There is a history which is present. Okay, all right. At what age is the dentition considered to be delayed? Okay, so options are option A 18 months, option B 6 months, option C 16 months, and option D is 13 months. Okay, so which is the correct answer, my dear students? So please listen to me. This is a case of very important mongoloid slant of eyes and epicanthic folds. So this is the case of which disease? Down syndrome. This is a case of what? Down syndrome. So Down syndrome, yes, they will have a delayed dentition. Delayed dentition. Okay, now the next question comes to us is what is Down syndrome? It is a trisomy of 21st chromosome. Very good, it is a trisomy of 21st chromosome. So the answer is which one? So remember, the answer is 13 months will be the delayed. Okay, 13 months. So please listen to me. We have something here. I will tell you people, then I'll come to whatever is written here. So what exactly I'm trying to tell you, we have something called as primary teeth. What is that? Primary teeth. Okay, so primary teeth will start if it is considered delayed. Primary teeth dentition is delayed if 13 months. If 13 months. Okay, remember, if it is 13 months, 13 months, no dentition. The age is 13 months and no dentition, then it is considered to be delayed dentition. So if there is no dentition, delayed we will consider. Okay, so 6 months, 11 month usually anomalies can see. And now we are talking about dentition. Okay, all right, so please listen to me. Here it is 13 months. Okay, so primary teeth completed by which age? Again, this is also a question. Completed by 2 to 2.5 years of age. 2 to 2.5 years of age. Okay, so very simple. Question number 1, like, what is that? When do you consider delayed? Till 13 months no teeth is a delayed dentition. If primary teeth is completed by primary teeth should be completed by when? If they ask 2 to 2.5 years, 2 to 2.5 years, the completion of teeth should be present. Okay, so what are the causes for delayed dentition? Usually it is due to familial causes. Then rickets, all of you know what is rickets. Rickets is a condition which is caused by deficiency of vitamin D3. Idiopathic causes. Okay, endocrine congenital hypopituitarism means pituitary gland is not working, and also congenital hypothyroidism and hypoparathyroidism, these can also lead to delay of dentition. Congenital hypopituitarism, okay, and congenital hypo thyroid and hypoparathyroidism, these are the causes for delayed dentition. So delayed dentition, quick review, just listen to me. Delayed dentition, when do you call delayed dentition? If dentition did not occur by the months of 13 months. Okay, up till when it will be completed? It will be completed by the age of 2 to 2.5 years. What are the causes? Familial, rickets, endocrine causes, congenital hypopituitarism. So these are the causes for, what is that? Causes for delayed dentition. So the answer is 13 months. समझ में आ गया? Understood बच्चों? Chalo. Let's go to the next one, that is Down syndrome and also cranial dystosis. Okay. Let's go to the next one. What is the use of the given device? What is the use of the given device? So mid-arm circumference, length at birth, skin fold thickness, body weight. Come on, quickly tell me the answer. What is the instrument used for? So let's see, mid-arm circumference. Already we know which tape is used. Shakir's tape. Which tape is used? Shakir's tape. Which tape is used? Shakir's tape is used. Length at the birth is measured by your favorite meter, infantometer. Infantometer. Okay, very good, Puneet and Twinkle, both of you are correct. Skin fold thickness, we already told you what is that, Harpenden calipers, and body weight is the correct answer. It is used for the measurement of body weight. Okay, all right. So once we understood about this, let's go to the next question. So which of the following parameter not used for the assessment of growth? So among the given ones, growth assess करने के लिए, to assess whether the baby's growth is normal or abnormal, to assess that, what is the parameter not used? What is the parameter not used? So weight, height, mid upper arm circumference, mid forearm circumference. Okay, so what and all is used? So mid upper arm circumference, mid arm circumference is used done by Shakir's tape. So this is a anthropometric data, all three of them, A, B, C. Okay, A, B, C. These are used for the assessment of the growth. These are used for the assessment of the growth. But mid forearm circumference, where do we use it? It is used for the assessment of malnutrition. What is that? Malnutrition. Very good, Varun Patel. Very good. Sorry, Vrunda Patel. Okay, I'm sorry. Okay, so what is that? Malnutrition. Malnutrition, that is used for the which type of malnutrition? Acute malnutrition. Used for what? Acute malnutrition measurement. Okay, chaliye. Let's go to the next question. What is the name of the abnormality shown in the image of an infant with the hearing loss? The answer देखो, hearing loss, okay, discomative rash, okay, hepatosplenomegaly, and generalized non-tender lymphadenopathy. So options are rickets, hypothyroidism, Down syndrome, Hutchinson teeth. Okay, चलिए बता दो quickly. What is the answer, बच्चों? What is the answer? Come on, quickly. Let me know the answer. चलो बता दो. So Punit says it is D. Others, guys, come on quickly. Very good. The answer is Hutchinson teeth. Okay, so please listen to me. So rickets, Down syndrome, and hypothyroidism, they will cause delay of dentition. Okay, but when we are talking about Hutchinson teeth is seen like this. Okay, so this is your Hutchinson teeth. Okay, so these Hutchinson teeth are seen with the congenital syphilis. Okay, so congenital syphilis, what are the clinical features? Let's see. Congenital syphilis comes as a result of what? Comes as a result of Treponema pallidum. So that is when the baby is in the mother's womb, mother would have a syphilis and baby will develop this. Okay, so chanting that Paras is here. So I hope there is a session waiting for our students. I think chanting will be there, I think. And let's continue with the congenital syphilis. What is that? Congenital syphilis, Treponema pallidum. The child will have SNHL, okay, and also your hepatosplenomegaly and also generalized lymphadenopathy. These are the clinical features of your, what is that? Congenital syphilis. So there is one important question you need to remember. हटचिंसन ट्रायड बच्चों. What is that? हटचिंसन ट्रायड. मेरे साथ रिपीट करो. हटचिंसन ट्रीट, interstitial keratitis and SNHL. SNHL is a late manifestation. So please remember what is that? That is Hutchinson triad. Hutchinson's triad. You can remember with the mnemonic his. Remember with the mnemonic his. What is that? Hutchinson teeth. Okay. Hutchinson teeth, interstitial keratitis, and SNHL. SNHL will be a late manifestation, so please do not get confused. It's a very, very important question. Chaliye, let's continue to the next question. Which of the following feature would not be present in a 10-year-old girl evaluated for the short stature who is not attained menarche and shows no breast development with suspicion of growth hormone deficiency? What is the case scenario here? So she is not had attained the menarche, okay, and also she is evaluated for what? Short stature. So she is short and there is no breast development also, and suspicion of growth hormone deficiency is possible. Okay, so if there is a suspicion of growth hormone deficiency, they are telling there's a decrease of growth hormone. There is a decrease of growth hormone. Which of the following is not seen? Okay, option A, early closure of the plates, growth plates, decreased muscle mass, reduced insulin sensitivity, slow linear growth. So what and all the possible things? Let's see. Okay, so let's start with early closure of plate. Actually, growth hormone is required. GH is required for what? Yes, it is required for required. GH is required for the closure. GH is required for the closure of the plates. This is a very important point. GH is required for the closure of the plate, and definitely muscle mass will be very low because there is a decrease of growth hormone. Muscle mass will be less and slow linear growth. Growth will be there though, but though it is a slow linear growth, again this is a presence of growth hormone deficiency. Yes, growth hormone deficiency, it is seen. It is seen. Please understand, it is seen. Okay, so not early closure, there is a delayed closure. Okay, growth plate closure requires growth hormone. So the answer is reduced insulin sensitivity. Reduced insulin sensitivity. Which of the following is not seen? बच्चों ध्यान से देखो, कल यही ऐसे ही चीज को आप ध्यान पे रखना है. You should look at this kind of things. Not दिया है कि yes दिया है. So this is a very, very important point. Which of the following is not seen? Okay, so which of the following is not seen here? Will not be seen. Okay, not दिया हुआ, not be seen. Okay, X-ray of the which of the following site used for the bone maturation? Okay, all right, knee joint, wrist joint, shoulder joint, and ankle joint. Okay, so please remember your wrist joint, knee joint. So knee joint actually ossification and all completes by later in the age. Later in the age, approximately 14 to 16 years. So that is not used for the bone maturation assessment in the children. Again, shoulder also very late. Okay, and ankle, it is even more late, up to 18 to 20 years completion of ossification. So for that understanding, we require what is that? Wrist joint. It is a wrist joint. You're absolutely correct, Dr. Ishan. It is a wrist joint. Okay, so very simple. Bone maturation in the children. In the children, if we want to assess, that is very, very simple. We are going to use wrist joint. Why not other ones? Because they will close later, so we will not be able to understand, but wrist joint will be their useful thing. Wrist joint is a joint which is formed by carpal bones, your radius and ulna. Very good, very good. Absolutely correct answer. Let's go to the next question. A 4-year-old boy is brought to the OPD by his mother due to delayed milestones, short stature, and obesity. A physical examination shows bowing of legs, proximal limb shortening, macrocephaly, and a trident hand. X-ray shows champagne glass appearance. Here, मिल गया आपको. X-ray shows champagne glass appearance of the pelvis. What is the most likely cause of his short stature? Okay, so come on, tell me. Achondroplasia, osteogenesis imperfecta, rickets, and congenital hypothyroidism. So please listen to me. Bowing of limbs is there, but please understand delayed milestones, and also obesity. So obesity, you might think hypothyroidism. Hypothyroidism actually normal birth weight. normal birth weight. Hypothyroidism, normal birth weight. Okay, this is a very very important point to be remembered. So here macrocephaly is there, trident hand. So this is a case of, it is not, this is a case of not osteogenesis imperfecta, it is a case of achondroplasia. Okay, it is a case of achondroplasia. When we are speaking of osteogenesis imperfecta, there will be recurrent fractures and blue color sclera. Blue color sclera will be given to you. Okay, answer is A, bache. Okay, so what is this, what are the signs? Remember the signs of achondroplasia. Signs of achondroplasia, signs of achondroplasia are your champagne glass appearance in the pelvis. This is a very very important point, and it's a type of dwarfism, short limb dwarfism. Milestones will be delayed, obesity will be there, bowing of the legs, proximal limb shortening, large head, and trident hand. So I want you to remember three things here. Trident hand, very specific sign. Bowing of legs can be seen in rickets also, don't get confused. So trident hand, champagne glass appearance of pelvis, and also obesity and delayed milestone. These are the 4 points I want you to remember. Okay, clear? All right. So let's go to the next question. So the next question, let's understand. Mother expressed the concern about her child's unwillingness to eat properly. Means child is not eating properly. Her 15-month-old son length falls 2 standard deviation below the median for his age. How many standard deviation? 2 standard deviation. Remember, 2 standard deviation. What is the most probable medical condition? Okay. All right. Options are acute malnutrition, severe wasting, moderately unweight, and moderate stunting. What is the answer? Come on, guys. Come on. Quickly tell me. So the answer will be what? Acute malnutrition? No, acute malnutrition will be what? Weight and the height. Weight and the height will be differentiating. And when we are talking about severe wasting, standard deviation will be more, and moderately underweight. It's not the underweight alone. Here also growth they are speaking. So the answer is moderate stunting. The answer is very good. Moderate stunting. Moderate stunting. Okay. So first let's understand what is stunting. Okay. So when we are talking about length for age, stunting is length for age is having standard deviation below the normal. Okay, all right. So below the how much? Below the child's length of age is below the 2 standard deviation. 2 standard deviation. Then we will call it as a stunting. But when we are speaking of acute malnutrition, it refers to a recent severe deficiency. Severe deficiency of energy, proteins, and other nutrients that can lead to wasting and edema. In this, there is no sense of acute malnutrition. Acute malnutrition means we are looking at weight and height. We are not looking age and height. We are looking at weight and height. Okay. All right. Let's go to the next one. क्या हो गया? Sir, नीट पीजी 11th अगस्त. भाई अभी ये क्या क्या करेंगे पता नहीं है यार. अभी ये लोग क्या क्या करेंगे पता नहीं है. कल हमारा एग्जाम सुकून से हो जाए. That is the thing I want. Okay. चल. Gonadal growth corresponds with what? Brain, skeletal muscle, lymphoid growth, dental growth. So the growth of the gonads, that includes both testicle and your ovaries, both of them. So their growth will correspond to what? Brain, skeletal system, lymphoid growth, and dental growth. Which one is the correct answer? Come on, guys, बच्चों को जल्दी बता दो, quickly बता दो, आंसर बता दो. Come on, quickly. So the answer will be, so it will corresponds with the skeletal system. Gonadal growth always corresponds with the skeletal system. बच्चों किसके साथ? Skeletal system के साथ compare किया जाता है. Because remember, so gonads are responsible for the production of testosterone, okay, and also estrogen, and this testosterone and estrogen also play a role in the skeletal growth, so that is why skeletal growth. So please remember, so skeletal growth corresponds with the, yes, very importantly, what is that? Skeletal growth corresponds with the This is your gonadal growth. Very good बच्चों, correct answer. चलो let's continue. I think there is some lag, इसलिए मतलब आपका आंसर आने तक ये हो जा रहा है. Okay, how many primary teeth does a 3-year-old child have? Okay, so please listen to me. Very simple. What they are asking is primary teeth. So primary teeth are nothing but what? So primary teeth are nothing but your milk teeth, bachcho. Primary teeth are nothing but milk teeth. Okay, so milk teeth. So these are your temporary. Okay, so what about the permanent? Secondary teeth. Secondary teeth are the permanent one. So secondary teeth will be permanent, and secondary teeth totally 32 teeth will be there. Upper jaw 16 and lower jaw 16. But when we are speaking of primary teeth will be of 20 teeth. Primary teeth will be 20 teeth. And remember, fully formed by primary teeth, fully formed by the age of which age? Fully formed by the age of 2 to 2.5 years of age. Okay, so very good. The answer is 20 teeth. That is your 20 teeth. 3 years age. So that should be, what is that? That should be completed. Okay. Chalo. So an average child by the age of 3, before the age of 3, by the age of 2 to 2.5 itself, completely they will have, what is that? 20 teeth. By the age of 6 to 7, the permanent teeth will start to form, and by the age of 21, so upper jaw will have 16 and lower jaw will have 16. Okay, 2.5 years is the cutoff. I want you to remember it. Okay, let's go to the next question. A child was brought to the pediatrician with the short stature. On evaluation, growth hormone levels are found to be high. Growth hormone is increased and insulin-like growth factors levels are low. What could be the abnormality? So, what could be the abnormality? Option A, GH deficiency. Option B, GHRH deficiency, GH receptor resistance, IGF deficiency. So, what is the diagnosis? Okay. So, चलिए फटाफट इसको सीख लेते हैं. Normally, you have one thing called as a growth hormone. What is that? Growth hormone, releasing hormone coming from your hypothalamus, coming from your hypothalamus. This growth hormone will stimulate your pituitary gland, and pituitary gland, my dear students, pituitary gland will go and produce growth hormone. Now growth hormone go and stimulate something called as growth hormone receptors. So these growth hormone receptors, where they are located? Usually they are located in the liver. From there, what will happen? Your liver will produce insulin like growth factor 1. Okay, so what is the diagnosis? All of you are telling D. D is not a correct answer. यहाँ पे ध्यान से देखो. So what they're telling? High level of growth hormone. So growth hormone is high. Okay. So growth hormone is high. Though growth hormone is high, the question comes to us is this one. What is that? So that will be growth hormone is high. Very nice. Growth hormone is high. Now growth hormone is high, but now what is happening? It will go and act on the liver. Where exactly? On the growth hormone receptor. So if growth hormone receptors are not working, so basically growth hormone activity will not be there. So if growth hormone activity will not be there, insulin like growth factor level will be reduced. So growth hormone receptors are not working, insulin like growth factor will reduce. So the answer will be, very importantly, growth hormone receptor resistance. Answer will be C, bacho. What is that? C. That is your growth hormone receptor resistance. If growth hormone is more, normal case scenario, if growth hormone is more, automatically there should be increased level of IGF, insulin like growth factor. But if that is not happening, means receptors are not working. So the answer is resistance of the receptor. Okay. All right. Let's go to the next question. What age it is recommended to introduce the solid food to an infant while continuing the breastfeeding? Okay. Options are 2 months, 6 months, 12 months, 18 months. Okay. So when we are supposed to, so what exactly here we need to understand? Exclusive breastfeeding is done for 6 months. Okay. And after that, along with that, the age of 6 months, this is a point to be remembered. So what is that? At the age of 6 months, we can include solid food. We can include, what is that? Yes, we can include solid food. We can include solid food. We can include solid food. So this is a guidelines given by World Health Organization also. Okay, you're absolutely correct, Ishan. What is that? That will be 6 months. ओके सो अभी आप लोग एफएमजी वाले प्लीज सुनो मेरा बात. अब नीट पीजी का छोड़ो, वो पूरा कंफर्मेशन आने तक उसके बारे में टेंशन नहीं लेने का है. ठीक है, चलिए. So what is the answer? 6 months. Very good answer. That is your 6 months. Let's go to the next question. Okay. What is the next question? A 10-year-old child is brought to the OPD with the history of repeated fracture for past 2 years. Remember, I told you people sometime back only, repeated fractures for past 2 years. Okay. And on the examination, blue color sclera and dental abnormalities are noted. There is a family history of similar complaints. Which of the following is the diagnosis? Which of the following is the diagnosis? Options are scurvy, rickets, osteogenesis imperfecta, osteomalacia. First thing, osteomalacia, let's rule it out. Osteomalacia is a disease of adults. ओके. स्कर्वी के अंदर होता है व्हाट? ब्लीडिंग शुड बी देयर. स्कर्वी विल हैव ए ब्लीडिंग. स्कर्वी occurs because of vitamin C deficiency. Okay, then the next important one, that will be your rickets. Rickets will be due to vitamin D3 deficiency. And here also again the symptoms of rickets are totally different. So craniotapes will be there, frontal skull bossing, and your rachitic rosary will be there, bowing of the bones will be there. None of them are there. Blue color sclera along with this thing. So answer, you are absolutely correct. Osteogenesis imperfecta. They can ask you again question. Osteogenesis imperfecta occurs because of what? It is a defect of which collagen? Defect of type 1 collagen. Defect of what is that? Type 1 collagen. Type 1 collagen defect will lead to what is that? That will lead to osteogenesis imperfecta. Type 2 collagen defect will lead to chondral dysplasia. Type 3 collagen defect will lead to Ehlers-Danlos syndrome. Type 4 collagen defect will lead to very important Alport syndrome. Okay, all right, quickly we have revised all the collagen defects. Let's go to the next question. Okay, what is the most specific sign of Kwashiorkor? Pitting edema, weight loss, flag sign, and muscle wasting. Come on guys, tell me which of the following given is a more specific for Kwashiorkor. So Kwashiorkor में कौन सी symptom most specific होता है? Come on. So the correct answer is absolutely, remember what is that? That will be your pitting edema. What is that? Pitting edema. Pitting edema. Correct. You're absolutely correct. So not flag sign. The most specific is pitting sign. So Kwashiorkor is what type of disease? It is a type of malnutrition. So it is a type of malnutrition of what? Of proteins. Okay, if proteins are less in the body, so automatically there is, most importantly, there is a decrease of albumin. If there is a decrease of albumin, it will decrease the oncotic pressure of the blood. Oncotic pressure कम हो जाएगा. If there is a reduction of oncotic pressure, what will happen? Fluid or water, okay, fluid/water goes to tissues. If it goes to tissues, it will lead to edema. Okay, other signs are very non-specific because weight loss can occur with marasmus also, for example. Okay, so pitting edema, you are absolutely correct. Anurag and your Vrund Patil, both of you are absolutely correct. That is your pitting edema. It is a pitting edema. Why? Because the most important point, remember, Kwashiorkor mein reduction of albumin will be there. Reduction of which protein? Albumin will be there. Let's go to the next question. A 10-year-old child is brought to the OPD with a constant fatigue, abdominal pain. He is also falling at grades in the school and Peripheral smear shows crescent-shaped RBCs. Crescent-shaped RBCs. Which of the following likely to improve the condition of the child? Urgent transfusion, hydroxyurea, analgesics, and intravenous fluids. Okay. So the child is having what is that? Constant fatigue. Yes, sir. Constant fatigue is there. Abdominal pain will be there. Okay. Peripheral smear as a crescent-shaped RBC. So basically, what is happening? This is a sickle cell anemia. This is a case of a sickle cell anemia. If there is a sickle cell anemia, what will be there? Sickle cell anemia, my dear students, please understand. So it is due to replacement of glutamate by valine. Glutamate by valine. So in which the hemoglobin will be sticky hemoglobin called as a HbS. Okay, and also there can be slight increase of fetal hemoglobin. So for this purpose, what is the treatment? Okay, so it is not an emergency, so we don't require an urgent transfusion. Sir, heart failure with a low ejection fraction. Please understand. Low ejection fraction means yesterday's topic. I'm just quickly telling you, if it is going less than 30% and there is a repeated symptoms of acute heart failure, chronic heart failure with acute heart failure onset. Chronic heart failure means decompensated heart failure. That time you are going to add digoxin. Till then you are going to add sacubitril plus valsartan. Clear, Ishan? Okay, all right, let's come back here. So sticky hemoglobin will be there. So in this case, what is the treatment? So IV fluids are of not great use here. So we are left with the hydroxyurea and analgesics. So the best answer, my dear students, is hydroxyurea. Hydroxyurea. If they ask you drug of choice for sickle cell anemia, again the treatment will be your hydroxyurea. What is that? Hydroxyurea. Okay, so the correct answer is, very good answer, hydroxyurea. What is that? Hydroxyurea. So don't get confused. So this is a clear-cut question. Hydroxyurea is the best option. Let's go to the next question. A newborn present with icterus extending up to lower abdomen, all of the following would indicate physiological jaundice of newborn except which is not a physiological. So which one of the following does not belong to physiological jaundice, they are asking. Okay, so palms and soles not stained yellow, resolution of the clinical jaundice by 2 to 3 weeks. Okay, dark colored urine. Okay, and also no clinical jaundice in first 24 hours of life. So please understand physiological jaundice. Physiological jaundice. So physiological jaundice, my dear students, quickly I'll give you points to remember, like a pointer. So very simple thing. Physiological jaundice starts on day 3. Physiological starts on day 3 and it progress up to day 6 or day 7. Day 6 or day 7, physiological jaundice will go off. Okay, and here there will be increase of unconjugated bilirubin. Here will be increase of unconjugated bilirubin. So because of that dark colored urine and dark colored stools in the diaper, so dark color stools will be there and it will resolve by day 6 to 7. And palms and stoles not stained yellow. Yes, palms and stoles will not be stained yellow. Physiological jaundice, palms and stoles will be spared. So the correct answer, resolution by 2 to 3 weeks. So it is not associated with physiological jaundice. It is associated with pathological jaundice. Pathological jaundice usually persists more than 2 weeks. More than 2 weeks. Okay, so the answer is B, bachu. Answer is B. Confuse mat hona. For this, answer is B. Okay, so resolution of clinical jaundice by 2 to 3 weeks. 2 to 3 weeks तक persist होगा तो pathological jaundice which will persist more than 2 weeks. Okay, चलिए आगे बढ़ते हैं quickly. A term neonate delivered by cesarean section with mild respiratory distress soon after the birth, which improves spontaneously over hours. Chest X-ray shows the fluid in the inner lobar fissure. What is the likely diagnosis? HMD, hyaline membrane disease, neonatal pulmonary alveolar proteinosis, okay, transient tachypnea of the newborn, and bronchiolitis. Okay, so let's understand. So what is the answer? The Nishan says TTN, transient tachypnea of newborn. So very simple. Here you need to understand, normally fluid is filled in the baby lungs. Okay, consider these are the lungs. Okay, amniotic fluid will be filled in the baby's lungs. Okay, so consider these are the lungs. Baby's lungs are filled with what? Fluid. Baby's lungs are filled with what? Fluid. Okay, now what happens during normal vaginal delivery? During normal vaginal delivery, baby passes through the birth canal. Baby passes through the birth canal. Okay, so due to that birth canal passage, there will be high pressure. There will be high pressure. So since there is a high pressure, what will happen? All the fluid will go out. All the fluid will go out of the lung. Go out of the, okay, so go out of the lung. So simple as that. क्या होता है? So when there is a excessive pressure, all the fluid will go out. Baby will be normal after normal vaginal delivery. But here what happened? Here is the cesarean section. So cesarean section means birth canal usage was done or not done? Not done. So small amount of fluid can remain in the lung and which will go out on its own by some time, which will lead to a disease called as a transient tachypnea of the newborn. Transient tachypnea of the newborn. And remember, X-ray shows fluid in the interlobar fissure. Only fluid in the interlobar fissure. Sir, what about neonatal pulmonary alveolar proteinosis and HMD? So hyaline membrane disease. Hyaline membrane disease is seen with preterm labor. Is seen with the preterm bache where there is no surfactant, they will develop hyaline membrane disease. And neonatal pulmonary alveolar proteinosis, this is a wrong answer because it will have diffuse opacities. It will have diffuse opacities in both the lungs. In both the lungs, in the bilateral lungs, there will be diffuse opacities. There will be diffuse opacities. Then we will can consider neonatal pulmonary alveolar proteinosis, where there is an excessive deposition of the protein in the alveoli of the lung. Alveoli of the lung. Okay, so this is the story of your what is that? This particular transient tachypnea of the newborn. Let's go to the next question. An 8-year-old unimmunized child was brought to the emergency with a high-grade fever, projectile vomiting. Thank you so much. An 8-year-old unimmunized child was brought to the emergency with a high-grade fever. Okay, projectile vomiting. यहाँ पे आ गया projectile vomiting. Intracranial pressure is high. Okay, there is a headache and there is a rash. Wow, very nice. And examination reveals neck stiffness. Okay, so this is a case of, already we know that meningitis. This is a case of meningitis. So once we know that it is a case of meningitis, then question comes to us is, sir कौन सी meningitis? तो चलिए देखते हैं. On lumbar puncture, CSF analysis revealed elevated protein. Okay, there is an increase of protein. All right, and decreased glucose, very nice. And neutrophilia, very good. There is an increase of neutrophils. What is the most common cause for this condition? So streptococcus pneumoniae, Neisseria meningitidis, herpes simplex, and group B streptococcus. Okay, now the answer is what? यहाँ पे कंफ्यूज होने के लिए मैंने एक ट्रैप लगाया हूँ. यहाँ पे दिया हुआ है रैशेस हो रहा है. Okay, so streptococcus pneumonia, even if it causes pneumonia, I agree with you, but rashes will not be there. With rash associated will be Neisseria meningitidis. The answer is Neisseria meningitidis. Okay, so आप लोगों को अभी clearly बताता हूँ. Viral meningitis, bacterial meningitis, viral, bacterial. So see, if it was, there was no rash, then it would be streptococcus pneumonia, bachcho. But rash is there. Rash is associated feature of meningococcal meningitis. Star shaped rash होता है. कौन सी rash होता है in meningococcal meningitis? Star shaped rash होती है. Okay, star shaped rash. Okay, अगर rash नहीं होता streptococcal pneumonia, I agree with you. Okay, so bacterial and also your TB meningitis. आप लोग क्या कर देते हो, बहुत सारे चीजों को याद करने चले जाते हो. You start to remember many things. I want you people to remember, one is protein, one is glucose, and one more is WBC. Okay, so among these three things, which one will be the answer? Let's, like, you know how to define. In viral meningitis, proteins might be normal or maybe increased. In bacterial meningitis, proteins always increase. In TB meningitis also, proteins always increased. Okay, in viral meningitis, glucose will be normal or even increased because virus does not consume glucose. But in bacterial meningitis, all the glucose will be consumed by bacteria. So bacterial meningitis, glucose will be reduced, and tuberculosis is also a type of bacterial meningitis. There will be decrease of glucose. Okay, so then we have WBC. In viral meningitis, increase of lymphocyte मिलेगा आपको. In viral meningitis, increase of lymphocyte, and in bacterial meningitis, increase of neutrophils, and in TB meningitis, increase of lymphocyte. Okay, so this is the scenario. So use this table and you people should tell me. So if there is a patient with meningitis symptom and there is an increase of protein, there is a normal glucose, and there is a increase of lymphocyte. What is the diagnosis? Whether it is bacterial, viral, or TB. So bacterial, viral, or TB. Which one is the correct answer? Come on, jaldi batao. So protein is increased or normal? Agreed. Normal glucose and increase of lymphocyte. Yes, that is a viral meningitis. But increase of lymphocyte and increase of agar आपको protein दिया होता, if I would have given that case scenario, then would be your answer would be what? TB meningitis. Okay. So this is a very very important question. Do not get confused. ये table को अच्छे से देख लो एक बार. This is going to help you. Okay. Meningitis को differentiate करने के लिए. Overall most common cause of meningitis, yes, that is streptococcus pneumoniae itself, but pneumonia में rashes नहीं होते, इसलिए बोला मैंने बस. Okay, कोई confusion होने का जरूरत नहीं. Okay, चल, let's go to the next question. So a 7-year-old girl always had to wear a warm socks even in summer season. Oh my God, summer season she want to wear socks. Okay. On physical examination, it was noticed she has a high blood pressure. She had a high blood pressure and femoral pulses were weak as compared to the radial and carotid pulse. Chest X-ray is given below. What is the diagnosis? Jaldi jaldi batao bachcho, what is the diagnosis? Femoral artery thrombosis, coarctation of aorta, Raynaud's disease, and Takayasu-arteritis. So here what is there? So that there is a first thing, there is a increase of blood pressure, weak lower limb pulses, weak lower limb pulses, and lower limbs are cold always, so she need a warm socks. And also what they have told, what is that? Femoral pulses were weak. And remember, so compared to radial and carotid, means upper body is having proper blood supply, lower body is not having. And here what is there? Here in the chest X-ray, we can find small ulcer-like growth, ulcer-like changes below the rib, So if there is ulcer-like changes below the rib, this is called as a notching of the rib. And which notching also they can ask? That is inferior rib notching. You people are absolutely correct. The answer is coarctation of aorta. And also they can tell you lower limb weakness. They can give you this thing also, lower limb weakness, not able to run. Okay. And also they can bring you with a complaint such as the child, the lower limbs are feeling very weak and all. And apart from that, they'll tell you lower limbs are cold. And when you compare the pulses and the blood pressure of upper and lower limb, that upper limb will have a higher blood pressure and upper body is well developed, lower body is not well developed because of coarctation of aorta. After the 3 blood vessel which comes out from the aorta, the arch of aorta, usually what will be there? There will be narrowing and aorta will be like this. So automatically lower limb will have a less blood supply, that will create a inferior rib notch. All right, let's go to the next one. The following anomaly is noted in a newborn at the time of birth. Okay, estimation of which of the following antenatal period would have been helpful in identification. So basically, what is this? This is a case of encephalocele. What is that? Encephalocele. This is a case of encephalocele. This is a case of what? Encephalocele. It is a case of what? Encephalocele. So for encephalocele, what is the fetal marker? Means which could have been checked antenatally, which kisko check kar sakte the. What you could have done to prevent this? Okay. So options are, what is that? Beta HCG, inhibin A, acetylcholine esterase, and alpha fetoprotein. So beta HCG is a marker of pregnancy, and also it is a marker of yes, testicular cancer, okay, and also it is a marker of your choriocarcinoma. Okay, and which is the one we are going to use? So in this case scenario, we could have checked for alpha fetoprotein, also marker of one more important cancer, marker of very important cancer, that is a hepatocellular carcinoma, hepatocellular carcinoma, hepatocellular carcinoma. ठीक है बच्चों? So the answer will be D. It is not a given or anything. The answer is D. Okay. All right. So once we understood about this question, let's go to the next one. Very good. You're absolutely correct. HCC, hepatocellular carcinoma. Okay. Now, a 12-year-old boy present with deafness, recurrent hematuria. Okay. He's having deafness. Okay. He's deaf. Okay, and hematuria is there with investigation suggestive of chronic kidney disease. There is a family history of death of maternal uncle due to similar illness, means genetic exposure is possible. Light microscopy appears to be normal but abnormal on the electron microscopy. What is the likely diagnosis? PSDN, Goodpasture syndrome, thin basement membrane disease, Alport syndrome. Okay, so let's understand the symptoms. Deafness, hematuria, hematuria, and also there is a abnormality on electron microscope. What is the disease they are asking? Okay, so post streptococcal glomerulonephritis. So here there will be history of streptococcal infection, such as streptococcal scalded skin syndrome, sore throat, okay, pharyngitis. These are the possible things by streptococcal glomerulonephritis. So streptococcal infection will be there after few days, maybe around 8 to 10 days or maybe 12 days. After that, child develops a glomerulonephritis. Then we will call it as a PSDN or post streptococcal glomerulonephritis. Then Goodpasture syndrome, not a correct answer. Thin basement membrane disease, not a correct answer. Answer is it is not a minimum change disease. Understand, it is Alport syndrome. Why Alport syndrome? If thin basement membrane disease was there, only what should be there? Only the disease which is related to kidney, but also hematuria and deafness. So that is Alport syndrome. Alport syndrome is a type 4 collagen defect. Type 4 collagen defect. Type 4 collagen defect, and type 4 collagen defect, it will have SNHL, there will be hematuria, that is glomerulonephritis, hematuria, and it is a type of autosomal disorder, hematuria, and also the child can also have SNHL, hematuria. Apart from that, the child can also have hemoptysis. Okay, so it is a type 4 collagen defect. This type 4 collagen defect, it is caused as a result of Alport syndrome. Okay, SNHL, hematuria, hemoptysis will be there. All right, chaliye aage badhte hain. Let's go to the next question. So a neonate had a delay in the cry after the birth and developed features of HIE, hypoxic ischemic encephalopathy. On examination, he had hypotonia, exaggerated ankle reflex, recurrent focal seizure, myotopic pupils, and what is the likely stage of HIE according to Sarnat and Sarnat staging system. Okay, so they see HIE, hypoxic ischemic encephalopathy, is a birth injury because of which lack of blood supply to the brain and brain will get injured, called as hepatic ischemic encephalopathy. HIE can use two classification. One is there that is only called as Levin classification, Levin, and one more is there Sarnat and Sarnat. Sarnat and Sarnat. Okay, so we are going to discuss about Sarnat and Sarnat. Okay, let's see about the Sarnat and Sarnat staging system. Okay, so Sarnat and Sarnat has a three stages: stage 1, stage 2, stage 3. Okay, only three stages are there. So stage 4 is not there only. Okay, in stage 3 and stage 1 and 2. So in stage 1 usually there will be midriasis. What is will be there? Midriasis. In stage 2 there will be meiosis. Okay, so there is a meiotic pupil. Already the answer is very clear, meiotic pupil, and here this is variable. It can be midriasis, it can be meiosis. Again here the child will also have a difference of heart rate and seizures may be there, may not be there. Here there can be seizures will be there, and here no response to anticonvulsants, also no response to anticonvulsants, there is no response to the anticonvulsants also. Okay, and again again here remember, here will be tachycardia, here will be what will be there? Bradycardia. There will be bradycardia. Again here it is a variable thing. Okay, so these are the things which we need to remember. So meiotic pupil, and also there is one more thing, focal seizure, recurrent focal seizure. Yeah, they are not telling that there is continuous seizures are there, nothing like that. So meiosis, seizure, and also dystonia. So that answer will be your stage 2. You are absolutely correct, Ishan. Answer is stage 2. All right, let's go to the next disease. A 3.5-year-old child presented with a high-grade fever since 1 week. There is a cervical lymphadenopathy, red eyes, few erythematous papules on the trunk, and the tongue is as shown on the picture. Okay, then which among the following is appropriate? So let's look at the tongue. So tongue, what is happening? Yes, this is appearing like a strawberry tongue. What is that? A strawberry tongue. Strawberry tongue. So if there is a strawberry tongue, what is the disease? So and also lymphadenopathy is there. This is a case of, my dear student, Kawasaki disease. This is a case of Kawasaki disease. Okay, Kawasaki disease. So then what is the treatment for this child? Treatment: IV immunoglobulins, IV steroids, IV antibiotic, IV cyclophosphamide. What will be the answer? Chalo jaldi bata do. So what will be the treatment? So we are going to give this child IV immunoglobulin. So for Kawasaki disease, the treatment is IV immunoglobulin, and also we are going to add him with a aspirin. We are going to add them with a aspirin. This is a very, very important. Kawasaki disease, IV immunoglobulin and aspirin. These are the things which you need to remember. So how to know Kawasaki disease? So Kawasaki disease, remember, with a mnemonic, what are the things will be there? So C for conjunctivitis. The child will have a conjunctivitis, and also there will be polymorphous rash. But remember, it is a non-vesicular rash. So in this case also, here you can see non-vesicular rashes are present. That is there. Yes. Okay. There will be edema and erythema of the hands. Okay, adenopathy means lymphadenopathy, often cervical lymphadenopathy, and mucosa will be involved. Do not think that mucosa is spared, but that is why tongue is there. Tongue is, we are getting which one? Yes, the strawberry tongue. That means mucosa is getting involved. So cream is a mnemonic for remembering of your, what is that? Kawasaki disease. Okay, chalo, let's go to the next one. A child with a intellectual disability, okay, presents with seizures, okay, seizures Greeting like a salam. Greeting like a salam. On examination, hypomelanotic macule. Oh, here is the key point. Hypomelanotic macule. Hypomelanotic macule, and also subungual fibrosis. Subungual fibromas. I'm sorry, it is not fibrosis. Fibromas are seen. The drug used to abort the seizures in this case. What will be the treatment for this case? So first and most importantly, remember, so there is a recurrent seizure with the intellectual disability, and the most important, hypomelanotic macules. So hypomelanotic macules with a seizure is a suggestive case of, yes, very important, which disease? Yes, it is a case of infantile spasms. Infantile spasms. Infantile spasm. It is a case of infantile spasm. So drug of choice for the infantile spasm is ACTH. Is ACTH. The answer is IV-ACTH. Carbamazepine is an anti-epileptic, but it is not used in this case. It is used for generalized tonic-clonic seizure. Ethosuxamide is used for your, what is that? That is used for your absent seizure. Vigabatrin. Vigabatrin is a GABA transaminase inhibitor which has a side effect, that is vision disturbance, and vigabatrin is a, again, anti-epileptic drug, but that it is not that much commonly used due to its side effect, vision impairment. Vision impairment. So this is the story of your infantile spasms. Infantile spasms. Okay, very good, Dishan. You are absolutely correct. Let's go to the next question. A neonate who was born at 36 weeks, okay, period of gestation, has been brought to the hospital with the complaints of episodes of cyanosis which are worst while he feeds, and the child feels better and turns pink while he is crying. What is the appropriate management? So this is a case of cyanotic spells. This is a case of cyanotic spells. So for that cyanotic spells, it is cyanotic spells are seen with the tetralogy of followed. Okay, so what will be the appropriate management? O2 supplementation, IV antibiotic steroid, insert a oropharyngeal airway, perform a chest X-ray. What would you do next? So remember, whenever cyanotic spells are there, so we need to do knee to chest position. What is that? Knee to chest. So knee to chest, we need to put the baby's knees closer to the chest, means we need to make the baby to bend and bring the knees closer, and there will be improvement. And immediate thing you are supposed to do is supplemental oxygen. बच्चों फर्स्ट ऑक्सीजन देना चाहिए. अगर गलती से वो साइनोसिस, if there is a cyanosis, there is sign of hypoxia, अगर गलती से उसको, if it will become into severe hypoxia, it is a dangerous condition. First thing will be, appropriate management will be oxygen supplementation. Later you can perform a X-ray. Okay, so first thing will be IV supplementation of oxygen. IV supplementation of what? Oxygen. Okay, knee to chest position. You're absolutely correct, Ramkumar. Okay, all right. So once we are done with that, let's go to the next question. So what is the next? Yes, you are absolutely correct. Option A, answer is A. Okay, okay. A 4-month-old girl present with a mild respiratory distress. Okay. Mild respiratory distress. On examination, large tongue, hepatomegaly, and floppy limbs are noted. Chest X-ray reveals cardiomegaly. ECG reveals short PR interval and tall QRS complexes. What is the most likely diagnosis? Okay, so the child is having hepatosplenomegaly, limbs are floppy and floppy limbs are noted, respiratory distress is there, chest X-ray shows cardiomegaly. So cardiomegaly like this given in this image. Okay, ECG reveals, okay, Pompey's disease, viral myocarditis, okay, Epstein anomaly, and Kawasaki disease. Kawasaki disease, no heart involvement. No heart involvement. Kawasaki usually has no heart involvement. Okay, so we are ruling out what is that? Ruling out, that is Kawasaki disease. Okay, Pompey's disease. Pompey's disease, again, it is a type of storage disease. It is a type of storage disease in which dystonia will be there. In which dystonia will be there, and it is due to deficiency of an enzyme. What is the name of the enzyme? Deficiency of acid maltase. Acid maltase. It is a type of, what is that? Yes, that is a glycogen storage disorder, and we are speaking of viral myocarditis and Epstein anomaly. But here, my dear student, if it is a viral myocarditis, there is no symptoms of viral infection such as fever, maybe rash or anything, or maybe upper respiratory tract infection. None of them are there. So that is also rules out viral myocarditis. You are absolutely right. That will be your Epstein anomaly. Ishan and Pooja, both are absolutely correct. The answer is Epstein anomaly. Epstein anomaly is a condition where right atria will be very large. Right atria will be very large, and your, what is the tricuspid valve is more apically located. More apically located, leading to a cardiomegaly. Epstein anomaly. It can be caused by which drug? If they ask you again, that will be your lithium. They can also give a bipolar disease female who was on the treatment, they gives birth to a baby, has this type of symptom. What is the possible cause for this? That time also the answer is going to be lithium. Okay, so that is the question of your lithium. Let's go to the next one. A 2700 gram term baby, well and exclusively bred feed, was found to be icteric with total serum bilirubin of 20 mg per deciliter on day 5 of the life. What is the management? Stop breastfeeding, observation, phototherapy, exchange transfusion. Okay, so to understand this, first let's diagnose the case. Bilirubin of 20 mg per deciliter. So we have physiological jaundice. We have physiological jaundice. So physiological jaundice, my dear students, it will be less than or equal to 15 mg. If it is more than 20, it is suggestive of pathological jaundice. Point number one, it is a suggestive of pathological jaundice, and it is occurring on the day 5. Physiological jaundice occurs on day 3 of the life. Okay, so this is what is that the answer. The question will be, what is that? The question, my dear student, the diagnosis will be a pathological jaundice. Pathological jaundice. Pathological jaundice. So this pathological jaundice, here we are not going to observe. We are not going to stop breastfeeding. For all the pathological jaundices, we have one treatment which we need to remember. The answer is phototherapy. What is the answer? Phototherapy. We can also go for exchange transfusion. That is, if phototherapy is not working and other, like if anything very severe form of hyperbilirubinemia, but normally first line management is always a phototherapy. So there are some points, caveats I have got it for you people. So physiological and pathological jaundice. So remember, so it is appearance, when it will appear on day 3 and disappear by day 6. Physiological jaundice. Okay, if it is a term baby. If it is a preterm baby, it will appear on day 4 and disappear on day 10. Okay, and pathological, if it is a term baby, day 1. If it is preterm, also day 1. But duration of persistence more than 2 weeks, and it can persist more than 3 weeks in the pathological jaundice. Okay, confused matiyega, pathological jaundice. And total serum bilirubin is a very important point. It will be less than or equal to 15. Less than or equal to 15, then we will call it as a physiological jaundice. That is why the arms and limbs will not have staining, will not have a icterus, will not have a yellow staining. But pathological jaundice will have, what is that, limbs also being stained. And we used to use a one rule called Kramer's rule. We don't use that clinically anymore. Okay, all right, let's go to the next question. A 15-year-old boy is being evaluated for pubertal disorder and short stature. Okay, pubertal disorder and short stature. On examination, his testis appears to be of small volume. Testis is in a small volume. He has not attained any facial axillary hair. Okay, his parental height is normal and no history of any genetic disorder in the family. What would be the most likely diagnosis? Okay, all right. Klinefelter syndrome, familial short stature, Down syndrome, constitutional delay. Okay, so Klinefelter syndrome. What is Klinefelter syndrome? Klinefelter syndrome is a 47XXY. 47XXY. Okay, now familial short stature. Here family height is normal. So this is also wrong answer, because normal family height. Normal family height. Okay, then constitutional delay is and Down syndrome. Down syndrome, there is no signs of any other Down syndrome such as mental retardation, Mongolian eye appearance, okay, epicanthic folds, none of them are there. So Down syndrome is also a wrong answer. We are left with only one answer, constitutional delay. Okay, so why am I doing this rule out method? I could have gone directly into constitutional delay. Okay, so but instead of that, why am I doing rule out method? The same technique you should be able to apply tomorrow if you don't know your answer. If you don't know your answer directly, apply the method of ruling out one by one. You'll easily understand. Okay, what is that? That will be your constitutional delay. What is that? Constitutional delay. So constitutional delay children will have a short stature and gonads also will be small and no facial and maxillary hair, and this will be called as constitutional delay. Let's go to the next one. Okay, 3-month-old baby was brought with a jaundice and clay colored stools. The baby was found to have conjugated hyperbilirubinemia and periductal proliferation on the liver biopsy. What is the diagnosis? Okay, so first let's understand conjugated hyperbilirubinemia. So conjugated hyperbilirubinemia. So conjugated hyperbilirubinemia, what happens? So that can be seen with rotor syndrome, and that can also be seen with Dubin-Johnson syndrome. What is that? Dubin-Johnson syndrome, rotor syndrome and Dubin-Johnson syndrome, and also your biliary atresia. Okay, what is that? Biliary atresia. So all of these three things will have what is that? Will have your what is that? Elevated level of conjugated bilirubin. Crigler-Najjar syndrome is a deficiency of UDP glucuronil transferase, because of which there is an increased level of unconjugated bilirubin. Increased level of unconjugated bilirubin. Clear? Okay. Now conjugated bilirubin तीनों में बढ़ता है. How to understand? So Dubin-Johnson syndrome will have a dark pigment in the liver. Dark pigment will be present. In rotor syndrome, dark pigment kahan pe? In the liver biopsy. In the liver biopsy. Okay. So dark pigmentation, dark color liver. Here is the dark color liver given? No. So we are ruling out Dubin-Johnson. Rotor syndrome will have no dark pigmentation. There is no dark pigmentation. So then what is that? Here there is no dark pigmentation also. Rotor syndrome goes out of the root. And Crigler-Najjar, again Crigler-Najjar is a unconjugated hyperbilirubinemia. So we are left with biliary atresia. So biliary atresia will have periductal proliferation. Biliary atresia will have periductal proliferation. Periductal proliferation. So this is very, very important. So proliferation will be there. Biliary atresia is the absence of biliary tract. Absence of part of biliary tract. You're absolutely correct. Answer is biliary atresia. Very good, bacho. Chalo, let's go to the next question. A pediatrician notes that meconium is coming from the umbilicus of the baby. Oh my God, meconium is directly coming out from where? Umbilicus. While he was examining the newborn in the nursery, which of the following embryonic structure patent? Patent means remain open. Patent means remain open. Okay. So the options are ductus arteriosus, omphalomesenteric duct, and mesonephric duct, and urachus. Okay. So ductus arteriosus is nothing related here. Ductus arteriosus is present between the pulmonary artery and aorta. Pulmonary artery and aorta. Okay. All right. Then next one. What is that? That is your, what is that? Urachus. Urachus is a remnant of allantois. Remnant of allantois. Okay. Again, allantois. Again, this works with urinary system. Okay. So mesonephric duct. Mesonephric duct. Mesonephric duct. What is happening? Mesonephric duct, my dear students, it is associated with what is that? It is associated with the formation of epididymis. Okay, so we are left out with omphalomesenteric duct. The answer is omphalomesenteric duct. Omphalomesenteric duct. So defects of omphalomesenteric ducts. So what and all can occur? So this is normal. Normally there will be duct between the intestine and the umbilicus. Okay, so that is normal. So there can be, so half of it is disappeared, remaining lead to diverticulum. Okay, so that is there can be cyst like this. Okay, there can be fistula. Because of the fistula, what can happen? Your content from the intestine can come out, leading to what is that? Leaking of meconium. Or there can be a polyp formation and fibrous bands, which leads to intestinal obstruction. So these are the possibilities associated with what? Associated with the omphalomesenteric duct rupture. Okay, let's go to the next question. Okay, an 8-year-old boy found referred with TLC of okay 84,600. Flow cytometry revealed 34 lymphoblast, following which cyclophosphamide was started. Lymphoblast is there. Lymphoblast is there means acute lymphoblastic leukemia. It is a ALL. So for ALL they gave cyclophosphamide was started. On the same day, patient had anuria and seizure. Which of the following not likely associated? So what they did, they gave cyclophosphamide. So once they give cyclophosphamide, what will happen? That will lead to tumor lysis syndrome. Why tumor lysis syndrome? Because tumor cells are broken down. Tumor cells are broken down, leading to tumor lysis syndrome. Leading to tumor lysis syndrome. So tumor lysis syndrome means cell hota hai na. So basically tumor cell is there. By giving the drugs, we are killing the tumor cell. So tumor cells will release all its contents. So tumor cells will release serotonin 5-HT, that will release urea, that will release phosphate, that will release potassium. Okay, so potassium released leading to hyperkalemia. So hyperkalemia can be seen, so not associated pucha gaya. Okay, phosphate will be more. Phosphate will come and chelate the calcium. Phosphate will come and chelate the calcium. So calcium को chelate करेगा तो क्या होगा? Automatically that will lead to decrease of serum calcium. Okay, then that is will be hypocalcemia, and phosphate is excessively released, hyperphosphatemia will there. So urea is released, leading to hyperuricemia. What will not be there is yes, that will be your hypercalcemia is not seen. Hypercalcemia is a not seen with your most importantly tumor lysis syndrome. This is a very important question, very important question, multiple times asked. Which is not seen? Hypercalcemia is not seen, hypocalcemia is seen in tumor lysis syndrome. Okay, so once you understood about this hyperuricemia treatment, the treatment of hyperuricemia in tumor lysis syndrome, the drug of choice is rasburicase. What is the name of the drug? Rasburicase. For tumor lysis syndrome, hyperuricemia caused by tumor lysis syndrome, the drug of choice is rasburicase. This question can be asked possibly. Okay, all right. So that is a story of your, what is that? That is a story of your tumor lysis syndrome. Okay, so that finishes our all the important previously asked questions from the pediatrics, and I will not take up much time because we want to go through many other things before night. So I'll not take up your much time. Just listen to me 1 second. So do not get panicked. Khana kha ke jao. Definitely eat the food and go. Definitely please eat the food and go. Keep an extra copy of all ticket. Make 2 sets of all ticket and keep a photocopy of your ID also for any safety. Keep one ID. Okay, do not wear belt, do not wear fancy clothes, because some metal object is there, they will not let you in. Very simple clothes you wear, and do not wear belt, they'll make you remove the belt. So that is also a point to be remembered. And please wake up a little bit early by 6:30, then start getting ready. Reach the exam hall a little earlier only, and wait there, and you can go inside. Do not panic. After entering the exam hall, you'll have the 20-30 minutes. Just put your head down and sleep. Do not talk to many people. That will again create extra anxiety. Just try. You won't sleep. I do know that. Just put your head down like this and sit for some time. That is a better thing you can do. Okay, and whenever you're solving the question, if you feel this is a correct answer, yes, mark it and go ahead. And if you get some question which you never heard of, thank you, which you are never heard of, वो अगर हम तुम जिंदगी भर सुने नहीं हो ना भाई, इसका कोई आंसर पता ही नहीं है, तो टेंशन क्यों ले रहे हो? योर ब्रेन इज ट्राइंग टू हेल्प यू गेसिंग सम आंसर, पुट दैट एंड गो ahead. Okay, and please do not keep changing the answer again and again, multiple changing, don't do that. Make sure if you are putting a question into review, make sure you answer something and put it for a review. Make sure guess the answer, put that answer, then you put a question for review. Though without reading that, like without answering a question, do not put it for review. Okay, please remember this. Do not put it to a review without answering a question. So always answer something and put it for review. And also make sure to remember one point. There will be stretch of 3-4 questions or something like that. Maybe you don't know the answer for. Okay, that doesn't mean whole paper is going to be like that. Do not panic yourself. Keep yourself calm and go solve other questions, and don't play this game of like, I'll solve 10 questions of this chapter, I'll come to that one, this one. Don't do that. Once you start, go in order and finish it off, because if you start searching for questions, only image based first, only this one's first, you'll be losing time. Okay, and do not carry a water bottle, any or such things, because they won't let you take it inside. Do not carry a pen also, that is also not needed. And keep your ID and hall ticket, and keep yourself safe. And during the break बच्चों, पेपर वन को डिस्कस नहीं करना है. हमें क्या करना है, पेपर 2 के बारे में, सर्जरी हो गया, आर्थ हो गया, थोड़ा बहुत इमेजेस देख लेना. ठीक है, एंड थोड़ा बहुत खाना खा के जाओ, बिकॉज आफ्टरनून यू आर ड्राइंड आउट ऑफ एनर्जी. तुम्हारा ब्रेन को एनर्जी चाहिए, थोड़ा जरूर खा के जाना. दैट इज ए मैंडेटरी थिंग. ओके, so these are the advices and tips for exam. And I wish you all the very best, very good luck, and all our prayers are with you. Definitely all your hard work, what you have done for last 6 months, will pay off. Okay, so all the very best. Do well and come out with flying colors. All the best, bacho. Thank you. Bye bye.